Hi, I am Nurse D, and I am going to show you how to use your IV Veletri that your doctor prescribed for your pulmonary artery hypertension. First thing is to wash your hands and have a clean work area, but I already know you know that. So then you're going to gather your supplies. After you have all that, I have my bottles of Veletri. These are sample bottles. The real Veletri is actually a powder white. I also have 2 vials of either normal saline or sterile water. I have vial adapters. I have 1 vial adapter for each vial. I also have alcohol wipes, the CADD Solis pump, and I have CADD Solis extension tubing. I also have the CADD Solis cassette that we're going to fill. I have two 50 ml syringes, and I also have my little homemade central line with the little tubey here. Now, once we have all our supplies gathered all in one place, so we don't have to keep getting up to go and get stuff, we're going to open everything. My motto is what you do to one, you do to all. So at this point, I'm just going to open all the things. Now, I will say that once I do open my vials, I pop the tops on them. I use the alcohol wipe. I use 1 alcohol wipe per vial, and I wipe it for about 15 seconds, focusing on the middle where the injection is going to be taking place. And I leave them sitting on there until I am ready to use the vial. Once I have all my alcohol wipes sitting on there, I just proceed to open all of my other items that's on the table. And I make sure I leave them in the little plastic holder just to kind of keep a clean work area. You will notice that after I remove the top, I am holding the item securely in the plastic holder before sitting it down. That way it doesn't fly everywhere when I'm opening my plastic pieces. Now, what you will notice with the CAD Solis tubing is that both ends are covered with a cap. One cap is blue and one is clear. And because they're both covered with a cap, I just take it out the package and I set it on the table. The same is going to go for the cassette because the cassette is covered with a white cap as well. But be careful, it comes with a red cap in the package. Do not throw this cap away because you will need this for later. Now that I have everything open, I'm going to go ahead and take my valve adapter, remove the plastic piece that's covering the spike, and go ahead and insert it into my 50 ml bottle of sterile diluent. So sometimes this can be normal saline and sometimes it'll be sterile water. Once I put the vial adapter on the first vial, I go ahead and put the vial adapter on each vial. So that's already taken care of. And now, since these vial adapters are open, I will have to take 1 alcohol wipe per vial again, and I make sure I clean around the little crevice around here, and I wipe around there for about 15 seconds, holding the vial adapter so it doesn't twist. And once I wipe that, I also leave that alcohol wipe on there until I am ready to use it. Your next step is going to be to grab the 50 ml syringe and you want to kind of pull it and push it a couple times just to kind of loosen it up. Now I'm going to remove the alcohol wipe from my first 50 ml vial and I'm going to connect my syringe to my vial adapter. For this particular one, I have to push and twist. It does take a little bit of effort and you have to hold the little wings a little bit so it doesn't twist when the syringe twists. Once you have it securely connected, you're going to withdraw the entire 50 mLs from the vial. You want to make sure that you are holding the vial straight up to the sky and the syringe down below, and you're going to withdraw the entire vial of 50 mLs. Now, once you have all 50 mLs in the syringe, you can go ahead and disconnect the syringe from the vial adapter and you put your syringe back into the little holder and you can throw that vial away. Using that same 50 ml syringe, you are going to remove the alcohol wipe off of one of your bottles of Veletri and use that same motion to connect it. You're going to inject 5 mLs of your sterile diluent, whether it's normal saline or sterile water. You're going to inject 5 mLs into your Veletri and you're going to just do a slow twisting motion until the Veletri dissolved completely. Remember, for this step, you do not want to shake it vigorously. You want to just slowly twirl it and make sure all the diluent gets to the powder. Again, this test one is yellow, but your Veletri is going to be white. So when it is mixed, it's going to be just as clear as your solution in your syringe. Once you have it fully dissolved, now it's time to hold it upright as you did the previous vial and withdraw all of that back into your syringe. And then once that's all in, you'll go ahead and disconnect it from your vial. If your doctor only ordered one vial of Veletri, then at this point, you're going to go ahead and put this into your cassette. However, if your doctor ordered multiple vials, you're going to repeat this same step until all vials are mixed into this first syringe. So I'm going to take the same syringe I just put the Veletri in, connect it to the next vial of Veletri, inject 5 mLs, do a slow little twirl until it's dissolved, and then I'm going to withdraw that solution, and I'm going to continue for however many vials the doctor prescribed for me. And once I have all of my prescribed amount of vials of Veletri into that first syringe, I'm going to remove the white cap, careful not to touch the tip of the cap, and connect my syringe directly to my cassette and make sure the clamp is open. And we're going to go ahead and push the Veletri into the cassette. Again, this is yellow for practical purposes, but your Veletri is going to be clear. Once you've put all the Veletri that you mixed into the cassette, you're going to go ahead and clamp the tubing and leave the syringe attached because we don't want that end open. And once that's complete, you're going to go to your last 50 ml syringe. You're going to exercise it a little bit, and you're going to use that same motion to connect it to the last 50 ml vial. You're going to withdraw the entire 50 mLs from that vial as well. Once you've gotten all 50 mLs out of the vial, you're going to go ahead and disconnect and throw that away and put your syringe back into the little holder. Then you're going to go to your cassette. Make sure your clamp is clamped before you disconnect your syringe. Now be careful when you're disconnecting your syringe. You don't want to touch that open piece. If you do, wipe it with alcohol. Then you're going to take your next syringe, go ahead and connect it to your cassette, unclamp, don't forget to unclamp, and push that last 50 mLs in. Sometimes this can be a little hard, so you'll have to use the table. Depending on your dexterity, you might have to use the table to push the syringe downward. And this is happening because the cassette is getting full and the pressure is being more and more. So once you get it all the way down, make sure you don't release the syringe, because if you do, all the Veletri will come back into the syringe. So once you push it in, you keep the pressure on the syringe while you clamp your tubing. Picking up the cassette, you will notice that there's an air pocket. So what we want to do at this point, we want to kind of rotate the cassette in all kind of motions to collect all the little air bubbles that may have collected while we were putting all of the Veletri into the cassette. Once that's all collected, put your cassette into just a household coffee mug with the blue to the sky. You'll see that the air is collected right at the top of that cassette. And then you're going to release the clamp so the air can start coming out of the cassette and into the syringe. During this point, you want to hold the syringe straight up. I'm holding it at an angle just to show you, but you'll see that the air is coming from the cassette into the syringe. And once you have your Veletri right before that first line on the syringe, you know that's enough. So go ahead and clamp your tubing. And then you'll remove it out of the cup and you will get your red cap. Go ahead and open your red cap just like we opened everything else in the beginning by holding the cap so it doesn't fly away once you remove the cover. You'll set your red cap down and grab your syringe, careful not to touch the tip, and make sure your clamp is closed. Disconnect the syringe from the cassette, pick up your red cap and connect it to your cassette to form a seal. And your last step here is going to be to remove the blue cap from the cassette. You should have a label to label your cassette, and also because Veletri has a 4-minute half-life, you will take that cassette, put it in the fridge, and take the one in the fridge out so you can use it currently. But always label, date, and time your cassettes. Once you get your cassette out of the refrigerator, if it's tubing change day, you'll go ahead and get your new tubing. Now, please know that both ends of this tubing will fit on your cassette. So whichever end has the filter, it goes closest to your heart, and you use the other end to connect it to the cassette. So you will then remove the red cap without touching the end to contaminate it. And you will also remove the blue end of the tubing without touching it so the ends are not contaminated. Connect the two together, twist them, and it should be locked. Now it's time to grab your CADD Solis pump. Make sure you have new batteries in there. It's recommended to change the batteries once a week. To connect your cassette to your pump, you pull the silver level down, and you will notice on your cassette that at one end it has two little feet and one end it has just a little notch. You will connect the feet to the feet on the pump and the notch to the notch. And this is how you will connect it. Once it's connected, sometimes you have to pull the level down a little bit so it'll connect before you push the level up to lock it. Once you have that secured, it is time to turn your pump on, turn it to the side. There's a power button on the side. Again, make sure you change your batteries. If you don't know how to do this, you just twist the top and it'll spring open, and it takes 4 AA batteries. Once you turn the pump on, you will hear a series of about 6 beeps, and it's letting you know that the pump is ready to use. The first thing you're going to do is program your pump. So press the soft key on the program. Most of these pumps have a lock code, so when you press select to change the rate, you will have to put in a code. I'm not sure what all the codes are. Once you put in a code, you're able to change the rate to whatever your prescribed rate is that your physician gave you. Once you get that rate, you go ahead and press the soft key under save to save that. And then you'll scroll down to reservoir volume to reset it. Press the select button. And if you press the select button again, it will reset to 100. If it doesn't, just scroll to 100. After you have your reservoir volume reset, go ahead and press the soft key under save to save that. Once your rate and reservoir volume are set, go ahead and press the back button. And the next thing we're going to do is select tasks. This is where we're going to prime the tubing, which means just remove all the air from the tubing. Select prime is telling you to disconnect the tubing from the patient. Make sure all the clamps are open. So just go ahead and make sure all your clamps are open at this time before you press prime. Once you open that clamp, go ahead and hold the other end of the tubing in your hand so you can see it, and go ahead and press the prime button on the pump, and the machine will start to prime. You know when it's finished priming if you see a drop come into this cap. So now you can see that the yellow solution has come into the cap. So I am going to press the soft key under stop priming to stop the priming. The pump is going to ask me if I want to continue priming, and if I haven't seen the drop, I will press yes, but because I've seen the drop, I select no. Then here I'm going to press the back button, and I'm going to go ahead and press the green and red start button. Before you start, the pump always wants you to review your pump settings to make sure everything is correct. You verify everything is correct by pressing the accept value button, and then you'll press the next button, and then you will be able to start your pump. Start your pump, yes, or at this point you can say no and connect it to your central line. Now I have my homemade central line here, so I'm going to open my alcohol wipe, get the tip of my central line, and I'm going to wipe this tip very, very good for a full 30 seconds to prevent any infection going into the bloodstream. Once it is wiped, do not let it go, do not drop it, and disconnect the cap from your tubing. Push and twist to connect it to your central line. Make sure your clamp to your central line is open and unclamped before you press the start button on the pump. Once all your lines are open and everything is secure, go ahead and press yes, and the pump will start. You will notice at the top it says running. This lets you know that the pump is running. Veletri is only good for 24 hours once you start your infusion. So make sure you date and time when you started your infusion and change it before the 24-hour period. Thank you guys so much for watching. If you have any questions, please put them in the comments. I hope this video was helpful to you, and good luck on your journey with pulmonary artery hypertension.